As new parents, every little sound or action from your baby can spark a question, and spit hup is definitely one of those things. It is messy, sometimes surprising, and often leads us to wonder if everything is okay. Rest assured, figuring out what is normal and when to seek help is a very common concern. For most babies, spit hup is a normal, healthy part of infancy, and usually does not requiring a trip to the pediatrician. Often, it is just your baby's digestive system maturing and getting used to the process of eating. However, there are specific signs that indicate when it is time to consult with your pediatrician to ensure your little one is thriving. The core reason babies spit up so frequently is due to their immature digestive systems. Specifically, the lower esophageal sphincter, which is a muscle that acts like a valve between the esophagus and the stomach, is not yet fully developed in infants. This means that after a feeding, it can relax more easily, allowing stomach contents to flow back up. Factors like overfeeding, gulping air, or simply being laid down too soon after a meal can also contribute to this common occurrence. To help you decide if a pediatrician visit is needed, pay close attention to your baby's overall well-being. Consider whether your baby is still gaining weight appropriately, seems comfortable and happy between feedings, and is producing enough wet and soiled diapers. If your baby is consistently meeting these developmental milestones and seems content, then their spit hup is likely a laundry problem, not a medical one. However, a visit to your pediatrician is a wise choice if your baby is spitting up forcefully, which is often referred to as projectile vomiting. Other red flags include persistent fussiness or crying associated with feedings, refusing to eat, or showing signs of discomfort after spit hup. You should also seek medical advice if you notice green or yellow fluid in the spit hup, blood, or if your baby is not gaining weight as expected. These symptoms can indicate more serious underlying issues such as gastroesophageal reflux disease, or GERD, or a feeding intolerance that needs medical attention. Understanding the difference between typical baby spit hup and more concerning symptoms empowers you to provide the best care for your infant. By observing their growth, comfort, and the nature of their spit hup, you can confidently decide when to monitor the situation at home and when to reach out to your pediatrician for expert guidance. Remember, you are doing a great job navigating these early days of parenthood.